So exam, pancreatitis. Your abdomen is very painful to examination, especially to deep palpation. So if you really push down hard on the person. Blood work. So there are a couple of things that are unique or somewhat unique to your pancreas. So your amylase, which is made by your pancreas, is elevated, but your parotid glands, because remember, carbohydrate digestion starts in your mouth. So your amylase will be high, but the other thing that is elevated that cinches the diagnosis is that your lipase, the enzymes to break down fat, is high. And that's what really nails it down, is that's the only place in your body that really makes lipase. Your glucose is elevated, which can be just because your pancreas is fried, and you have no ability to regulate your glucose, but also just as a stress response. When your body is stressed out, it starts making a whole bunch of cortisol, and your body releases a bunch of glucose. Your white blood count is usually elevated both as a sign of infection and also as a sign of stress. And your liver function tests can be high, partly because things can't get out through the bile duct anymore, and partly just because your abdomen's irritated. Imaging, ultrasound or CT would be helpful, and you might see gallstones this way, or just swelling and inflammation. And then there are other things that are endoscopic exams where they go in through your esophagus and stomach. They can stick a little camera up into the common bile duct and pancreatic duct to see if there's a gallstone lodged in there. I've never seen one of those done. I don't ever care to. Treatment. So NPO, which means nothing per os, nothing by mouth. You're usually in the hospital for a while. IV fluids to make sure you don't dehydrate. Pain control. And we're talking narcotic level pain medication. This hurts like you know what. And then I don't know if anybody came across this in their reading, but IV nutrition, or something that we call TPN, total parenteral nutrition. Sometimes they will actually drop a tube through your mouth into your stomach and try to give you very easy to digest nutrition into your gut. But sometimes they have to do it by IV, so they can give you a little bit of glucose, basic fats, and amino acids already into your bloodstream, and to avoid your gut. And they do this so your body doesn't start breaking down muscles and fat tissue, and to give you some nutrition, and to bypass your pancreas while your pancreas is trying to recover. And they usually have to do this through a major vein, so a central line, so like through a jugular or a femoral vein or something like that. It's a big deal. Mild to severe cases will usually get better in a couple of days. So, you'll be NPO and they can just give you IV fluids and pain control. The moderate to severe cases might need the TPN, where they have to do some nutrition, because some people will take weeks to recover, and you cannot just give somebody IV fluids for weeks. If you're severe and you start going into multi-organ failure, we're talking intensive care unit, and maybe dialysis, and maybe a ventilator, and definitely the TPN, and maybe antibiotics. Mild to moderate cases, you're almost a sure bet to survive. Severe cases where you go into multi-organ failure, there's up to a 30% risk of death. Risks of being a severe case to begin with: older age, alcoholism, obesity, and that's just a lot of comorbid conditions that go with it. So if you're obese, you might have a heart condition to begin with. If you have bad kidneys, this is harder to survive to begin with. Or if you have altered mental status when you come in, so if you're not oriented. So bottom line, your pancreas is a very delicate organ. It's an essential organ. You need it to do a lot of digesting. You need it for your nutrition, and you need it for nutrient absorption. It is at risk because of its exocrine function. If it gets damaged, it will digest itself. It can happen a variety of ways, but they all lead to the same endpoint. They get damaged, it eats itself, and then it gets irritated. And you want to intervene as early as you can so you don't lose endocrine and exocrine function. That's it. See you next time.